Hi, my name is Rima Bariban, and today I will explain a case which is known as acute pancreatitis. It's an emergency case, and I will explain it in a very detailed form. So, pay attention and don't forget to like, subscribe, and share. So, we have a case of a 35 years old woman. She complained of severe abdominal pain, nausea, vomiting, and steatorrhea. What does that mean? Steatorrhea. That means she recognized fat in her stool. So we should pay attention of the symptoms of the deficiency of the fat soluble vitamins, like bleeding symptoms, like pruner problems, and also the night blindness. Okay, so the physician diagnosed her with acute pancreatitis. Let's discover how the physician diagnosed her with acute pancreatitis. So let's start up about the causes of acute pancreatitis. So the first cause is idiopathic, and what that means that we sometimes we don't know what is the exact cause of the acute pancreatitis, and the most common cause I can say it's the gallstones, the gallbladder stones, and you can see in the picture how the gallbladder happy with that. So the most common cause is the gallstones, and we know that is a six of that we can diagnose with the gallbladder stones. Like she is a female, 40, fatty, fair, family history, and the other causes. So when the female has all these characters that maybe she has gallbladder stones, which is the most common cause of acute pancreatitis. The second common cause is ethanol. Alcohol is the most common cause of a chronic pancreatitis, but it's the second cause of acute pancreatitis. And we have also trauma, I mean here abdominal trauma, abdominal injury, and that is causes penetrating. And we have also the other cause which is known as steroids, and we know there are two mechanisms of steroids to cause acute pancreatitis. The first thing that steroids affect the immune system, and that is can be easily lead to the infection. At the same time, the steroids also cause hyperlipidemia, hypertriglyceridemia, and these causes also cause acute pancreatitis because it's overload on the pancreas, because the pancreas causes or secretes lipase enzyme which is digest the fats. So hyperlipidemia, hypertriglyceridemia, that is causes overload of the pancreas. And we have also the PAMS, which is the virus. And the virus, this PAMS virus, has a high affinity for the glandular tissue. So he loves glandular tissue. I mean here the salivary gland, the pancreas, the other tissues. Autoimmune because that is affect the immune system. So it's easily infected and easily infected by the pancreas. We have a scorpion sting. Actually, it's not about the scorpion stings, other toxins that is causes also acute pancreatitis because the pancreas is highly vascular, so the toxins can easily go to the pancreas and cause infection. We have hyperlipidemia and hypertriglyceridemia, and I said that hypercalcemia also causes acute pancreatitis. Endoscopic retrograde cholangiopancreatography, which is known as ARCP, and the ARCP actually it's a procedure that we can use it to diagnose and also to treat the pancreas. But in some sites or in when something that is goes wrong, that is can lead to the injury of the ducts of the pancreas or the bile ducts, and that is will lead to something which is known as acute pancreatitis. To drugs, the most common drugs that is causes acute pancreatitis is diuretics and antibiotics. So now we tell all the causes of acute pancreatitis. Wait a moment, there is an exciting video on the road. The upcoming video, I will discuss the functions of the pancreas. So don't go away.